What's up everyone? Welcome back to my YouTube channel. And in this video, we're gonna cover everything you need to know about improving your erections through cardio exercise. And I'm gonna teach you exactly how to get started. Trust me, it's a lot easier than you think. Now, if you're new here, my name is Eric. I'm a men's health physiotherapist, and this channel is dedicated to men's health physiotherapy and helping you to overcome men's health issues. I post new videos every single week, so make sure you subscribe to my channel by clicking the subscribe button below and join our growing community. It's long been preached that good heart health equals good hard health. Erections function from the complex interaction of a number of body systems, namely the nervous, muscular, and vascular systems. An inability to achieve a sufficient erection could reflect poor health in any of these symptoms. Cardiovascular-based exercise such as running, cycling, rowing can improve the body's ability to transport blood to the muscles and tissues that need it most. So it's expected that by having a better blood supply system, the delivery of blood with an erection also improves, meaning you will achieve a much firmer erection. Although some of you might have erectile dysfunction, improving the blood supply system is an important element to improving your sexual function. Completing a structured cardio-based exercise program is a tool that is often not taken seriously enough to improve erectile dysfunction. Alright, so what do you need to know right now to start getting better erections? From the research, it is shown that men who complete higher levels of physical activity and exercise are more likely to report that they can achieve good, firm erections. These benefits from exercise apply to all men wanting to improve their erections, even those with higher cardiovascular disease risk factors, such as obesity, high blood pressure, high cholesterol, and diabetes, or after a radical prostatectomy. Being more physically active and exercising regularly, in this case referring to cardiovascular or aerobic exercise, works to improve the function of erections through a number of ways. Now, as you may already know, cardio exercise is vitally important to manage and control health conditions that negatively affect the function of the blood supply. Health conditions such as diabetes, coronary heart disease, obesity, high blood pressure, and high cholesterol. These conditions are highly prevalent in older men with erectile dysfunction. So if you've been to the doctors lately and they've told you that you have some of these conditions, well, it's time to listen up, take some notes, because this next part of the video is really gonna help you. Okay, now what is cardiovascular exercise? Well, cardiovascular exercise, also known as aerobic exercise, is defined as using the body's large muscle groups to move in a rhythmic manner for a sustained period of time. This is exercise that places a healthy amount of stress on your heart, lungs, and blood supply in order to deliver oxygen to the muscles which are requiring it to use as energy. Now, there are many different varieties of aerobic-based exercise, including running, swimming, walking, hiking, cycling, rowing, you name it. But you may have some personal preferences based on what you enjoy or what is best for managing some of your injuries, or even simply what you have access to. Now, how does cardio exercise actually improve erections? Well, as exercise leads to improvements in cardiovascular health, it is theorized that these benefits also flow on to erectile health. Cardio exercise specifically results in the greater ability of your heart to pump blood, your blood vessels to direct blood flow to your penis, and your penile tissue's ability to uptake and use that oxygen-rich blood. These changes are thought to improve the natural mechanism of erections, as erectile dysfunction is commonly a problem of delivering and keeping blood within the penis to maintain pressure, resulting in a firm erection. Now, normally erections work by receiving a nerve signal that allows arteries, which are vessels that deliver blood, to increase the amount of blood going to the penis. Cleverly, when greater blood flow enters the penis, the structure of the penis makes blood more difficult to escape by compressing its veins, which are vessels that remove blood. This is basically what makes your penis erect. Therefore, much of the mechanism relies on the ability of the blood vessels to expand and relax, and this is exactly what cardiovascular exercise helps you to achieve. Additionally, the blood circulatory system is a transportation system which delivers nutrients and messenger chemicals. This is also an important factor as it helps to deliver more nitric oxide to the genitals, and this interacts with the arteries to create expansion, very similar to how Viagra works. Although a little more of a theoretical stretch, it's also suggested that being more physically active and doing exercises such as running, swimming, rowing, or cycling can actually improve the function and strength of your pelvic floor muscles. Now, logically, we suggest that it might only have a small benefit on strengthening these pelvic floor muscles, and I would rather men to complete an individualized program that is properly structured and progressed to meet your needs. If you're looking for a video teaching you exactly how to strengthen your pelvic floor, be sure to check out the description below where I'll link my YouTube video. Now, to add further complication to the issue, erectile dysfunction is usually accompanied with getting older and the changes that occur within your body during this process. Aging causes a decline in most of your physiological systems, which is largely responsible for reducing physical function and performance. Particularly, this is attributed to changes in your muscle mass, your strength, and overall cardiovascular capacity, both of which can be used as predictors for future health, disease, and even mortality. It doesn't matter who you are, every guy is going to experience aging. However, the goal should be to preserve and maximize what function you currently have, as exercise is a powerful tool that is proven to have many valued benefits. Alright, how can you get started with a cardiovascular exercise program? Well, a key consideration with cardio exercise is to understand the principles of how to effectively implement and measure such a program. This relies on understanding the difference between what is meant by frequency, intensity, type, and duration. Now, when I'm talking about frequency, this refers to how often the exercise is completed per week. Intensity refers to the measurement of the difficulty of the exercise, where type, this is the type of activity being completed, for example, cycling or running. And lastly, duration is referring to the amount of time the exercise is being completed for. Common measurements for the intensity of aerobic exercise is with a rating of perceived exertion, also known as RPE, between 0 and 10. The RPE scale is simply a question you ask yourself while exercising. A score of 0 would mean that the exercise session was very easy, and a score of 10 would mean that the exercise session was extremely difficult and you're at your maximum level. However, one common fault with cardiovascular exercise is that it's very easy to convince yourself that you're doing it effectively. By this, I mean completing exercise at a challenging level for long enough and doing it regularly. Next, I'm gonna give you my top recommendations so that you can get started for yourself. All right, here are my recommendations for cardio and erectile function. Now, with frequency, you should be aiming for moderate intensity exercise, accumulating 150 to 300 minutes per week. That works out to roughly 30 to 60 minutes of exercise every day. And for vigorous exercise, accumulate 75 to 150 minutes per week, which is 20 to 30 minutes per day, or an equal combination of both. Now, for intensity, you should be aiming to achieve a moderate intensity, referring to an RPE of around 5 to 6 out of 10. For type, choose your exercise based on what suits you and what will achieve the desired intensity of what you have access to. So that could be a treadmill or an exercise bike. Now, for duration, with moderate intensity exercise, complete at least 30 minutes per day, which can be broken down into 10-minute chunks. Whereas for vigorous intensity exercise, a period of 20 minutes should be performed continuously. Although these recommendations are basic and do not cater to your ability and specific needs, these were developed from medical research as suggested targets for adults to achieve optimal health. So some of you may already be doing a sufficient level of cardiovascular exercise, or maybe going above and beyond. And this could include high intensity interval training or circuit type training, which is a great option for rapidly improving your fitness. But what if you haven't completed a program like this before, or have a few hurdles to get past in order to get started? Well, then I would recommend that you talk to your physiotherapist for guided advice and professional knowledge on how to get you started. Your physiotherapist will create you a personalized cardio program and ease you into this new level of exercise, and they will help you avoid getting any new injuries and work around any medical conditions you might have. And that's gonna wrap up today's video. Remember, regardless of your situation, your age, or your health, it's never too late to get started on improving your health and your erections. If you write yourself out a good plan, it's not gonna take you very long to start seeing some really good results in the form of better and firmer erections. And please, if you found this video helpful, I would love for you to click the like button and consider subscribing to my channel and joining our growing community. Thanks everyone, remember to keep going, and I'll see you in the next video.